Hi there, I am so excited to bring to you Monday Moves with Marian today. We are going to be talking about a foundational movement. Now, as you may have heard me say, foundational movements are the key to rehabilitation after breast cancer surgery. These are the movements which everything else is built upon. So it's super important that we get as much as we can out of these foundational movements before we get back to coordinated movements or complex movements or different types of sports activities or adding other activities that may require stability, that may require strength, because we know movement first, then stability, and then strength. We need to have that movement first, and that's what we're talking about today with shoulder abduction. So I say it like that, abduction, because there's another one that's called adduction. So just to make clear, abduction is moving away from the body, and we'll get to the classroom in just a minute and go through that. But I want to make sure that you don't feel left behind if you hear, oh yeah, foundational movement, it's been 5 years since I've had my surgery, I've got aches and pains, I'm just going to let it go. No. We are not just going to let it go, because you're watching this means that you want more. And I want you to have more, and I want to teach you how to get there. So if you've got aches and pains, if you've got tightness, if you've got fatigue, movement is key. And the foundational movements are really important so you can set the baseline for everything that you want to level up. So we'll be talking about shoulder abduction today, and all the tips and tricks are going to help make sure you get to your maximal ability. Again, we're not comparing to others, we're comparing to ourselves. A, what are our goals? Where do we want to get? B, do we have things that we're doing that we would like to improve upon? So those are the things that I'd like you to keep in mind. So I'm going to share my screen with you, and I'm going to show you a couple ways that we are going to be doing abduction, and I want you to learn with me because I've got some neat tricks in here. All right, I do need to mention too, of course, any activity that you do, I want to make sure that you have the approval and the consent from either your surgeon if it's right after surgery, or your oncologist or healthcare professional. So with that in mind, I'm sitting down here, and I wanted to just bring this in to show you that not everything has to be done in a standing position. So we'll take a look at how to do this in sitting as we look through the moves. So let's start with shoulder abduction, as I said, and what we're doing is moving the arm away from the body as high up as we can, moving the shoulder. We're bringing it back down, and again, everything I'm doing is nice and slow and controlled, because that means that you're getting the maximum movement that you can without bringing anything else into play. So I'm going to bring this back, and let's take a look again. So I'm going to start this off. I'm going to stop right here. And I want you to keep in mind here that we are seeing a nice straight line. So my fingers are straight, my wrist is straight, my elbow is straight, and everything is moving as one, because that means for sure we are moving that shoulder joint. That's all we want to move. So if you go back to one of my Monday Moves with Marian, I did thumbs and guns, and that is working on movement throughout the fingers and the wrists, so you can keep them nice and straight to make sure that you're getting your maximal ability out of this exercise. So when we bring this up, I want to see that all the way through we are keeping that nice straight line. That's what I want to see when you're doing shoulder abduction. And you may only get to this point, and that's absolutely fine. And sometimes too, I've worked with patients who have had frozen shoulder after breast cancer surgery and after treatment, and that shoulder sort of stops right about here. And this is what's called a painful arc. So they can get the arm up to here, and then after that, everything can be fine. But that arc in there can be really painful. And again, that's where you may compensate and not actually use this shoulder joint. But that's what I want to see moving. So if I bring this back down, one of the things, and I'll bring it down just a little bit, I've put my hand down here on my lap because it's almost like a little trick to make sure that I'm not moving that side of my body. So if my hand is nice and flat on my thigh here, then that's sort of like a marker for me that I'm not moving that side of the body. And that's what I want to make sure. I want these shoulders to stay even. I don't want to lean in there. So that's my way of keeping this nice and straight. And I know for sure then that it's that shoulder joint that's moving. So as I bring that up all the way, and then I bring that back down, that movement is all coming from that shoulder joint. So again, I don't care how far you're going, I care how well you're doing it. And again, if you want to progress, we keep working on this. That's exactly what this is for, is to show you how to progress. Now, I also want to take you through a clip in standing. Now, I want you to watch this and be aware to tell me what may or may not be wrong with this. So let's take a look. And we'll bring that back down. Good. We'll stop that. Was there anything wrong there? And first of all, am I starting in a position that's neutral? Or are my fingers rounded? My wrist is rounded? And let's see as we go through here. We'll bring that forward just a little bit. Stopping here. And that's not a clear place to stop. Let's move that up a bit. Here we can see that elbow is bent. Some of my movement is coming from the elbow. And this definitely may be a way that you are moving post-surgery. If you can't reach overhead, if you're working for a ponytail, if you're working to put something on, you may be bending that elbow to assist you when the shoulder can't move well. Absolutely fine to get done what you need to do functionally. But when you're working to improve movement, we want to do it properly. So having this elbow bent here and we'll go through here a little bit so you can just see, hand is not straight, elbow is not straight. This is not a fantastic way to work on improving shoulder movement. It may be a great way to reach overhead if I have to do that, but it's not a way to work on improving. So we'll run this through and we'll take a look at one more. And as you see this, I'm going to stop it here. And when we looked at me sitting in the chair, I put my hand on my thigh as a way to try to make sure I remember to keep things balanced. And if you look here, you can see that sway of the body, that movement. Again, if it's functional and you need to get something done, by all means. If you are training for improvement, this is not the way to do it. This is the tips and tricks that you need to be aware of so you know if you're cheating, which it's a bad word, but I'm going to use it because you're cheating yourself and trying to improve. So our body finds different ways to cheat to get the job done. But when you're doing rehabilitation, when you're doing movement therapy, we want to take the cheats out of the picture because we want to know what you can do maximally with the joints that we're working on. And right here, we're just working on the shoulder. So this sway in the body, this bend in the elbow, this is not helping my shoulder at all. It's a way to cheat. So, let's not do that. Welcome back. So just to recap, we're taking a look at shoulder abduction, and we want to make sure, as we learned in the classroom, that we keep a nice level body, that we're not leaning the spine to try and help out with those movements if we're training. Again, functional, yes, you need to do something, get it done. But when you're training, when you're working on movement therapy, that's a no-no. We want to see what you're doing. So if you're having problems with the fingers and the wrists and they're curling, you can't keep them straight, go back to one of my previous Monday Moves with Marion, take a look at thumbs and guns, and really work on those because it could be muscles, it could be fascia, but we want to get those nice and straight so that movement comes through all the way through the arms. So I will have more Monday Moves with Marion coming up. I'd love for you to hit that subscribe button so you are aware when they're coming out. If you have any questions, if you have any concerns about this exercise, if you're not 100% sure what you're doing or you just want to double check, then DM me, send me an email, send me a video of you doing the exercise, and we can go through it together. I would love to help. Have an awesome day.